Hi, everyone. Today I'm presenting the Recovery and Resilience Group designed for adults in early stages in order to sustain recovery from substance use disorder in an outpatient setting. This group focuses on reducing relapse risk, strengthening coping skills, and supporting long-term recovery through structured evidence-based interventions. So I am going to share my screen so that you could follow along with me. Let's just make the sound is there. All right. So what is group practice? As you see here on the screen, group practice is a therapeutic approach where individuals with shared experiences come together to support one another. What makes group work powerful, especially in recovery, is the sense of connection where clients begin to realize they are not alone, which reduces shame and increase engagement. Now, some intervention strategies we have cognitive behavior therapy, which helps participants identify triggers and reframe negative thought patterns. Second, relapse prevention strategies. We also incorporate mindfulness and emotional regulation techniques to help clients manage those cravings and stress. Additionally, person-centered therapy creates a safe, non-judgmental space for healing. Person-centered therapy creates a self and supportive environment where participants feel heard and respected. Increasing that skill build-in, acknowledgement of the addiction and recovery tools. Now, together, these strategies promote both behavior changes and emotional healing. Let's dive into some group dynamics. This is where we see strong peer support and accountability, which is essential in recovery. At the same time, some members may initially present with resistance or withdrawal, especially due to stigma or past trauma. We may also observe dominant personalities, which require facilitation to ensure a balanced participation. Managing all these dynamics is key to maintaining a safe and effective group environment. Now, there are some risks. Three issues I'll address that may arise is the relapse or trigger of activation. When this happens, the approach is supportive, not punitive. We normalize the experience and redirect clients back to coping strategies. Second, microaggressions are biases. These are addressed immediately using a trauma-informed and educational approach, helping members understand the impact of their words while maintaining psychological safety. Thirdly, boundary and confidentiality concerns. The facilitator will reinforce expectations and model ethical behavior. We want to make sure those boundaries are in place from the beginning. Now, how this group supports social workers, how the social workers address the issues. Here are some key information. It's important that social workers in the agency are supported by providing a structured intervention model, improving client engagement and retention, addressing both clinical and social determinants of recovery, creating measurable outcomes for treatment effectiveness as well. Now, we did cover a lot, but I do want to share that having those boundaries in place, the confidentiality concern, utilizing the tools, right, to help those outcomes of reducing relapse risk, increasing those coping skills, improving emotional regulation, and the strongest possible peer support system. It not only strengthens clients' outcome, but it also enhances the quality and impact of social work practice within the agency. Now, we did use some references here. I'll note them in the message, but we want to make sure that we're supporting not only the social workers, the agency, but also the recovery client. We want to reduce a relapse risk from start to finish. I hope you enjoy this presentation. I am looking forward to growing and learning with you all. Thank you so much. Again, Recovery and Resilience Group. presented by Tyra McGarry.